All of a sudden, we're all getting worried that healthcare reform is going to cost too much and return too little. Now is not the time to lose faith. Now is the time to demand that we get it done right. We need to get beyond all the special interest groups. Politics, and politics alone, is the greatest reason that we do not have healthcare reform in this country. The lion's share of the political blame rests squarely with the most conservative of our politicians. To pick just a few, I am most upset with Senator McConnell and Senator DeMint. Senator McConnell has become the voice of scare tactics recently. The problem is, his facts just don't add up. Recently, he attacked a hospital in an eastern Ontario city and announced extensive wait times for certain procedures. Trouble is, the director of that hospital openly disputed his figures, as did local conservative politicians. You can't just make up numbers that you throw around. He also commented on national television that a friend of his knew a Canadian that needed to come here for treatment because he was told he was too old in Canada. Those old friend of a friend facts are particularly hard to track down. We need some reality in this. If he wants to talk about Canadian satisfaction with healthcare, why not quote established facts? Because they don't back up his ideology, that's why. Gallup did the only poll that I could find of both Canadians and Americans. They asked if they were satisfied with their access to healthcare, and they asked if they were satisfied with the quality of care. Twice as many Canadians were satisfied with their access, and the same amount in both countries were satisfied with the quality of the care. Not exactly the resounding disappointment of all Canadians in their healthcare system. To back that further, we're the ones discussing healthcare, not Canadians. We're the ones spending 16% of our GDP. They spend 10.3%. Now, Senator Jim DeMint of South Carolina gets the award for the most blatantly political statement against healthcare reform. He was recently quoted as saying this regarding healthcare: "If we're able to stop Obama on this, it will be his Waterloo. It will break him." DeMint went on to say, "And we will show that we can, along with the American people, begin to push those freedom solutions that work in every area of our society. Push them. That's what we have today. There's nothing to push here. We are living in the senator's utopia right now. I don't know about you, but his idea of freedom solutions feels more like a colonoscopy to me. According to the Department of Health and Human Services, health care is going to cost $8,000 per person in 2009. That's per person, not per family. In 2007, healthcare spending accounted for 16.2% of our GDP. It's expected to grow to 20.3% by 2018. We spend 1% of our GDP servicing our national debt. We spend less than 3% of our GDP on gasoline, fuel oil, and other energy sources. So think about that. In 9 years, our spending increase, only the increase on healthcare, will be more than all the money that we currently spend on these two areas. We paid $650 billion more for our health care in 2008 than other industrialized nations would have paid. And we have 50 million people uninsured. Over 10 million of these are children. Think it won't happen to you? Think again. In 2007, 62% of personal bankruptcies were caused by health problems. 78% of those people had health insurance. 67% owned their own house. 60% had a college education. They never felt it would happen to them. People do not realize they are one diagnosis away from financial collapse. Underinsurance is a great hidden risk in our healthcare system, and this risk is getting larger every day as insurance companies struggle with limiting benefits to avoid even higher premium increases. Senator DeMint thinks the freedom solutions that we currently have in place are exactly what we need. If you were in his position, you probably wouldn't want to change either. I counted 20 different plans available to him on the DC page of the federal government health insurance options. His salary as a U.S. Senator is $174,000 in 2009. He lives at the C Street dormitory in Washington for a measly $600 per month rent. Members of Congress are eligible for a pension at age 62. A pension if they have completed at least 5 years of service. DeMint began serving in Congress in 1999, has been a member since. He will be 58 on September 2nd. Senator DeMint's pension will not be affected by the economic freefall that has depleted the rest of our 401k accounts. A pretty sweet deal for a die-hard conservative that believes in free market policies, just for the rest of us, not for him. The rest of us get what our companies can afford to offer for health care. We rarely have choices. This usually means that premiums are increasing substantially every year, services are declining, and deductibles are going up. Many more have no choice at all. They must buy their own insurance and do not enjoy the economies of scale that Senator DeMint enjoys. According to an article in the GreenvilleOnline.com, on July 20th, 670 people a week lose their health insurance in South Carolina. That's DeMint's home state. Think about all this for a minute. Senator DeMint is fine with simply killing health care reform because it will be President Obama's Waterloo, meaning it will be the beginning of the end for him. Pure politics, while 670 of his constituents per week lose their health insurance. Maybe we should worry less about the empathy of our Supreme Court nominees and worry more about our legislators, that they give a damn about the people they represent. Now, I want to be fair here. Conservatives are not the only ones to blame in all of this. If taxing benefits is the best way to pay for it, then that's what we need to do. The Congressional Budget Office has come out in favor of this method as being the most effective and relative way of raising revenue. I don't care if unions fought hard for these benefits. We need to reach some parity here. We need to modify how we pay health care in this country as well. If we truly want to reduce costs, then we have to change the way we pay. We need to pay for results and not for procedures. There are far too many procedures done in this country that do nothing to improve the health of the patient. An important part of this change is to cap the malpractice settlements. We need an environment that is conducive to providing the care that is needed. Wasteful procedures are done every day to simply cover the backside of a doctor. You and I are paying dearly for these wasteful procedures. We have to make sure that we get legislation passed. It has to ensure that affordable health insurance is available to everyone in this country. It has to make sure that we do not deny people affordable insurance because of prior conditions. And we need to make sure that policies are transparent and that they cover what people need covered. We cannot have this increase in limited benefit coverage. It is simply face value insurance. So those three things have to be done. And whether it's public or not is not the concern. What is the concern is that we make the changes that are needed and that we get it done now. Because every time we wait, every minute we wait, it's getting more expensive to get done. Now today I have written my senators, both of them, and it wasn't the first time I wrote them. People have to communicate. The Senate is where it's going to make or break in this. And we have to make certain that we force our senators to do the right thing. So write them today. If you don't know who your senators are, go to www.senate.gov. Your senators will be listed with links to their website, and you can email them. You can phone them. Their phone numbers will be on there. Or you can write them a letter and put it in the mail. Whatever way you want to do it, just stand up and do something. It has to happen now. Thanks.